Assalamu alaikum. Let me welcome you on behalf of Ahsan Academy to a presentation on thoracic wall. This is the first presentation of a series of presentation on thorax. Let us fix the objective first. We will clarify the concept of the thorax first, then we will continue with the surface features, formation of the thoracic wall, features of the thoracic cavity, and at every stage we will correlate the anatomy with the clinical aspects. This is the trunk, which is the central part of the body from where the neck and the four limbs are extended. The trunk has two major parts divided by the diaphragm, which is indicated here. This is the diaphragm, and above the diaphragm is the thorax, and below the diaphragm is the abdomen. So this diaphragm is the central partition between these two parts, thorax and the abdominopelvic cavity or abdomen. You see on the right side, this is the diaphragm, and above this is the thoracic cavity, which is the cavity of the thorax, and this is below this total abdominal cavity is divided by one line. You see above this is the abdomen proper, and below this is the pelvic cavity or pelvis. So today our discussion will be continued on thorax. You can see the coronal section on the right side and a median section on the left side of the body, showing the clean cut diaphragm, position of the diaphragm, and this is the position on the coronal section. So the diaphragm is separating the thorax from the abdomen. The part above the diaphragm is the thoracic cavity and the wall together making the thorax. Below the diaphragm is the pelvic cavity. You can see this line running from the sacral promontory and a plane here through the inlet separates the abdomen proper from the pelvic cavity. On the left side, this is the abdominal cavity proper, and this is the pelvic cavity. You can see in the figure that the thorax, you can see there. By this time we understood that this is the position of the clavicle, and actually this is the position of the root of the neck. So this is extending from the root of the neck, and below this is actually abdomen. So this is running between root of the neck and the abdomen. For the study of the anatomy, we will discuss the surface features first, then we will go for the thoracic wall. You can see in the section the wall, and the change of color, this is indicating the cavity. In the cavity there are organs. So in this presentation and subsequent presentation we will cover all these step by step. Let's start with the surface features. See on the right side, this is the thoracic wall, anterior thoracic wall, and on the left side the scales and the structure deep to actually skin and muscle are shown by sketch. See, this is the jugular notch. It is the upper border of the sternum, actually the manubrium sterni. If we roll our finger on the either side, we'll get the clavicle. I can identify the two ends of the clavicle and can determine the midpoint of the clavicle. If we draw a line vertically downward, this is the mid-clavicular line. So mid-clavicular line is the vertical line running downward from the midpoint of the clavicle. The midpoint of the clavicle can be identified observing the two ends and taking a point in between. Say the anterior part, the median part is anteriorly formed by the sternum. So this is the position of the sternum, and this line, black line, is indicating the curved sketch of the this position of the rib, and rib anteriorly has costal cartilage, and this helps the rib to be attached to the lateral margin of the sternum. So if we roll our finger on the anterior surface of the sternum, we'll get an elevation close to the upper part. This is sternal angle. To this sternal angle, the second rib remains fixed or makes a joint. So this sternal angle is an important feature and helps to count the rib. At that level, we will get the sternal angle. We will get the second costal cartilage. If we roll the finger laterally, we will get the second rib. So with the help of this, we can easily count the ribs downward. This is second rib shown by the arrow. This is the lateral side. And the lateral side, we can see the axilla. This is axilla, and this is upper limb. So upper limb is connected to the trunk by anterior axillary fold. This fold is making the anterior wall of the axilla. So we also get posterior axillary fold that attaches to the trunk, thorax. So this is posterior axillary fold. We can make a point on the anterior axillary fold on the thoracic wall, and similar point on posterior axillary fold attaches to the thorax. So we can easily draw two parallel vertical lines. One is anterior axillary line and another is posterior axillary line. So we can draw vertically anterior axillary line and posterior axillary line. So we can easily find out the point in between, the midpoint between these 2 points, and this is the point that is helpful to draw the mid axillary line. If we draw a vertical line and from this point, this on the lateral wall of the thorax, this is mid axillary line. This is very helpful for the clinicians to count the rib and to identify several points which will help them to carry on. We have made it a larger photograph in this film, and you can see this is the vertebral column, and this point is most prominent in this furrow. This is known as vertebral prominence. This is actually spine of the 7th cervical vertebra. This one is the scapula and the clavicle. Though it is in the wall of the thorax, they are not bone of the thoracic cage. This is part of the upper limb bones, and this is known as pectoral girdle. We can easily identify on the back the spines of the thoracic vertebra by palpation and by feeling, and we can count them from the above, like first thoracic, second thoracic, and so on. But it is not very prominent because the spines are very oblique, pointed, and overlaps each other. If we identify the features from outside inward, the outermost is the skin, then is the fascia, then we'll get the muscles, and in between muscles there are bones. So in this way we should study the gross anatomy of the thoracic wall. You can see the muscles. These muscles are actually connecting the upper limb with the thoracic wall. So thoracic wall is formed by the bones and the muscle, osteomuscular wall, and this These are the muscles. You can see the some of the muscles connecting, who are superficial, connecting the limbs with the thoracic wall. So these are actually considered as the muscles of the upper limb. Now, in between ribs, we can see some muscles. These are actually intrinsic muscles of the thoracic wall. So we will consider these muscles as the thoracic wall muscles, and these are the bones forming a cage that forms the thoracic wall, and this is known as thoracic cage. So we should study the anatomy of thoracic cage now. This is the thoracic cage, and if we want to express how the thoracic cage is formed, we should start from one side. Let us start from the anterior. So the anterior one is the sternum. After that, we will get the costal cartilages present with at the tip of the ribs. So then we will get 12 pairs of ribs, 12 on either side. Then behind, this is vertically present thoracic part of the vertebral column. This is the inferior thoracic aperture, also known as outlet of the thoracic cage, and above this one is the inlet or superior thoracic aperture. You can see this is the superior and this one is the inferior. So this is the thoracic cage shaded, and you can see this is the thoracic inlet or superior thoracic aperture, and this one is the outlet. You can see the inlet and we can see the outlet. The anatomically inlet is known as superior thoracic aperture. Aperture means opening, and this is inferior thoracic aperture. Now these are the costal cartilages. This is 7th costal cartilage, and subsequently 8, 9, 10, making a margin here. This is known as costal margin. So 7 to 10 costal cartilage fused together to make a margin here, obliquely running inferiorly and laterally. This is costal margin. So this two costal margin of both sides meets at the junction of the sternal second and third part. This is the body and xiphoid process. So at this point they meet, and this is known as subcostal angle or infrasternal angle. These openings between these, the space between ribs and costal cartilage, anteriorly bounded by the sternum and behind by the vertebral body, is the intercostal spaces. So there are 12 ribs and 11 intercostal spaces. Thoracic cavity, you see, full of various organs. Heart and the pericardium is situated at the center. On either side, we'll get the lung. From the heart, there are red vessels attached to the heart, and some other structures that was present in the thoracic cavity are part of the respiratory tract, content of the posterior mediastinum. This is content. It is esophagus behind the respiratory tract, and this is a large artery that descends downward in front of the vertebra. This is descending thoracic aorta. So this is the thoracic cavity. You can see this is thoracic cage as a whole, and this one is the diaphragm. So this is sternum, you can see on the lateral, and this is anterior view, and this one is the first rib. So this is extending from the first rib to diaphragm, not going up to the 12th ribs. So part of the thoracic cage is covering or making the anterior and lateral wall of the upper part of the abdomen. Diaphragm is much higher. So this is, if we see the diaphragm on the left side, this is in the mid-clavicular line. It extends up to the fifth intercostal space, and on the right side it is a fifth rib, up to the fifth rib in the mid-clavicular line. The dome of the diaphragm is situated. So diaphragm goes up and this lower ribs forming the wall of the abdomen. You can see these ribs are covering the liver. In the photographs you can see this is the vertebral prominence. This is actually not bone of the thorax, but it indicates the junction between the neck and the thorax. This is the spine of the seventh cervical vertebra. You see other bones include, this is scapula and this one is the clavicle. Scapula is an important landmark for the thorax. You see the superior angle of the scapula, it lies at the level of the second cervical spine. This is the scapular spine. If we feel medially, this lies at the level of third cervical thoracic spine. And if we follow this below, this is the inferior angle of the scapula. Let us find the openings. This is the inferior thoracic opening, and in the body this is covered by the diaphragm. The diaphragm actually separates the thoracic cavity from the abdominal cavity, and if we look up, this is the opening which is known as superior thoracic aperture or inlet. This is the boundary of inlet. We will go in detail subsequently. These are the intercostal space. Now let us go for the superior thoracic aperture. It is also known as inlet, and you see the colored area is the inlet or superior thoracic aperture, and it is bounded posteriorly by the body of the first thoracic vertebra. Then we can get the joint between the rib, head of the rib and the body of the thoracic vertebra. It is known as costovertebral joint. Then we will get the rib. This is the inner border of the first rib. This blue color area indicates this is the costal cartilage. And after that, this is the manubrium sterni, and it is the upper border of the manubrium sterni, which contains two notches, clavicular notch and jugular notch, two clavicular notches and jugular notch. So this is the boundary of thoracic inlet. Now if we pass a plane through it, the section will be like that. Actually the dotted mark indicates the position of inlet. So you see the lateral part is occupied by the apex of the lung, and some structure that enters into the thorax or leave thorax passing through this inlet. So let us see what are the structure passing through inlet. Diagram showing the inlet. This is from the above, this is from the side. The antral wall is removed, lung apex is in the neck. So apex of the lung occupies the two sides, most of the area occupied by the apex of the lung. In the midline, the large tube is the trachea. Behind that is esophagus. So these two structure occupies most of the area of the mid part. On either side, you'll get the brachiocephalic vein going to the thorax and unite together to form the superior vena cava. This is the vagus nerve going below, and this is brachiocephalic trunk on the right side, subclavian vein, artery, and the internal carotid, common carotid artery. So this is the brachiocephalic trunk coming out. This is common carotid artery and subclavian artery coming out on either side of the trachea. A small nerve, phrenic nerve, going down between this artery. So this is the superior thoracic aperture or inlet. The clavicle actually remaining here in this form. and these are the structures passing through the inlet. You can see the apex occupying most of the area on either side. The inferior thoracic aperture, this is the diaphragm closing it, and we can see the diaphragm making a partition wall. It is observed from the below, and some openings are there. Actually these are allowing to certain structure to run between the abdomen and the thorax. This is aorta, and this is esophagus, this is vena cava. So all these large structure passing through some openings in the diaphragm. Thank you very much for attending the